During the summer months, you likely think of protecting your skin from the sun, but you should also make sure that you're protecting your eyes as well. Dr. Catherine Heyman, founding dean at the School of Optometry at HPU, is with us. I gotta ask, is there a season for sunglasses, or is 365 the time when you should be wearing sunglasses?
It's really 365, Tanya. The skin around the eyes, the eyelids, as well as the actual eye itself is very sensitive to the sun, and the sun can cause a lot of damage to the outside of your eye as well as the inside of your eye. So wearing sunglasses all the time is extremely important anytime you're outside. But it's important to make sure that those sunglasses have 100% UVA and UVB protection. So wearing a cheap pair of sunglasses that doesn't have UV protection is actually worse than not wearing any kind of sun protection at all.
Okay, so we need to check for the little sticker that's usually on the glasses that say that.
Yes, and if you are at all concerned, you can bring it into your sunglasses into almost any optometrist, and they can check to make sure that it is blocking the UV rays for you, to make sure that you are being protected the way that you want to be.
Yeah, they have one of those little UV machines, right? And they just kind of put it on there and they're able to see.
Exactly. Exactly. So that way you just know that you have a quality pair of sunglasses. Anyone that you buy that is one of the brand names that we would get in a outside of like a drugstore, but at an optometrist office or at an optical are likely to be very good and high quality sunglasses. And of course, those are the ones that you're going to lose, right? You'll find
Right,
the
of
dollar
course.
one and you'll wear them forever. And as soon as you buy a $200 pair of sunglasses, you'll lose those the very next day.
Yeah, that is the rule for sure. We were having this discussion the other day when I was on my morning walk. One of my friends said, well, I have light eyes, so I always have to wear sunglasses. The other person said, well, I have dark eyes, so I don't really need to wear sunglasses. What does the doctor say about the color of our eyes in sunglasses?
It is more likely that someone that has lighter pigmented eyes would be a little more light sensitive. In other words, the sun itself would cause them to have a little more of a glare issue and maybe have some light sensitivity. We call it photophobia. And the darker pigmented eyes are probably a little less sensitive, but that doesn't mean that the lids and the cornea and the front of the eye and the back of the eye are any less sensitive. So they're just talking about whether or not they're bothered by the sun in terms of their vision. They're not necessarily talking about, does the sun damage their eyes? They are equally damageable in both light eyes and dark eyes.
All right, well, let's talk about the damage. What is the danger that sun exposure to your eyes can then happen over time?
So a couple of things. So if we start at the back of the eye and work our way forward, the back of the eye where the retina is, where you get the actual nervous tissue that allows you to see, being in the sun a fair amount and being exposed to sun can cause a condition called macular degeneration or age-related macular degeneration. And that has been well proven. So that's the first thing that can happen. In addition, or not the first, but that's something that can happen at the back of the eye over time. In addition, the front of the eye, the cornea, so it's the clear part. If you wear contacts, it's where you put your contact lens on. That can get like a sunburn, and it's extremely painful and really hurts. You have to have some care with an eye doctor to make sure that that's taken care of. And then the lids themselves are subject to actual skin cancer, just like the rest of your body. So you can get something called a basal cell carcinoma, even squamous cell, but basal cells are pretty common. In fact, I myself just suffered from one and had to have it removed.
Okay, so
Even though I wear sunglasses all the time.
Right, it can still happen for sure.
It still can happen.
Yeah, thank you for your time and your expertise, Dr. Catherine Heyman, there at HPU University. Thank you so much. Hey, if this is one of these interviews that you need to pass on to a friend because they're not wearing their sunglasses like they should be, this is going to be in the Two Wants to Know section of our website.